the questions we have for today are, number one, how are inflammation and oxidative stress related? And number two, what causes inflammation? So when we think about inflammation, we're really looking at our immune system getting agitated and attacking something. Now, we need inflammation. Inflammation is very important. For example, when you get an infection, if you got an infection and your body just, I don't need to get inflamed, nothing to see here, then of course you would die from the infection. So inflammation is a very good thing unless it gets to be too much, and then you start reacting with pollen grains and you get seasonal allergies, or you react with your own body and you get an autoimmune disease. You can just get general inflammation that's causing depression, anxiety disorders. So inflammation, it's good, but then if it gets to be too much, or misdirected inflammation is a better way to look at it, then you have all of these problems. So there's really what we call the deadly five deadly factors that cause inflammation. And those are vitamin D deficiency. Your body needs vitamin D to function properly. Chronic psychological stress, which can be caused by lots of things, life events, altered sleep cycles, stress at work, stress at home. Then you've got an inflammatory diet. That's a diet that's a modern diet, a lot of processed food, a lot of fat. You've got a sedentary lifestyle because we don't have to work hard. We don't work off that psychological stress. So those two are tied together. And then finally, we've changed the organisms that live within our body, which is a lot of my research is about. So all those things are deadly five. And then in addition to that, you can have exposure to chemicals, which can lead to a lot of kind of inflammation as well. And then inflammation, when it gets to be too much, that will lead to oxidative stress, because when you have a lot of inflammation, your body's trying to burn something, usually an infection or some drugs that were put in our body to fight the infection, such as antibiotics. But then that burning, if there's too much of that biochemical burning, then you get this other process called oxidative stress that causes the problems that we talked about previously. And that's the short answer with the connection between inflammation, what causes it, and oxidative stress.